Hi everyone, we are from B3 and we will presentate about our student project. And these are our members. My name is Arya, Tabina, Putri, Wigianto. The last 3-digit name is 081. I will explain about the background information. The liver is a vital organ in the human body that performs a variety of functions, including metabolism, immunity, digestion, detoxification, and vitamin storage, to name a few. The metabolism and/or detoxification of xenobiotics is one of the liver's most important functions. Some of these chemicals are processed by lysosomes in the liver, although biotransformation is a primary mode of metabolism and detoxification. The liver transforms xenobiotics primarily by transforming them to a lipophilic and a hydrophilic state via two reactions, phase 1 and phase 2.
My name is Indiarwan Anantaseno with last 3-digit name 091, and the problem formulation of our student projects are: what is the definition of impaired liver function? What is the relationship between pharmacology and impaired liver function? And what are therapies for impaired liver function? And our objectives are understanding the definition of impaired liver function, understanding the relationship between pharmacology and impaired liver function, and understanding the therapies for impaired liver function. And the benefits of our student projects are: we believe that this literature can improve the knowledge of medical students about problem base of impaired liver function in drug use. Hence, we hope this literature will bring improvement in clinical prevention and treatment of this disease. And the next one will be explained by my colleague. Thank you.
Hello, my name is Dewa Guptha with the last 3 digits of name 072. At the present moment, I'm going to present you about the definition and function of liver. Liver is one of the major organs that lies specifically on the alimentary system that has numerous roles that maintain and support metabolism, immunity, digestion, detoxification, vitamin storage or supply, among other functions. Liver has a big major interaction with the endocrine and gastrointestinal system since it has a big role in digestion and metabolism. In the metabolism and detoxification of drugs or xenobiotics, liver has a critical role in maintaining those processes. Most of these processes are facilitated through biotransformation by converting them from a fat-soluble into water-soluble for facilitating secretion into blood or bile. That's all from me. Thank you for the time.
My name is Aisyah Taqiyyaa with 3 last digit number is 076. So etiology and pathogenesis of impaired liver function. Impaired liver function can arise in many consequences such as autoimmune, allergy or toxic, exogenous for infection or vascular process or an inborn error metabolism. Chronic infection by hepatotropic viruses like HBC and HCV, excess alcohol consumption, non-alcoholic fatty liver disease, and others are some etiology of impaired liver function. On the other side, genetic factor may lead to liver impairment. Can influencing the susceptibility to liver impairment include modifiers of neurotransmission such as GABA and modifiers of alcohol metabolism. That's all for me. Thank you.
My name is Widya Santisutama with the last digit of name is 086. Today I'm going to talk about relation between pharmacology and impaired liver function, specifically about drug-induced liver injury or DILI. There are many classes of drugs that can cause DILI, especially herbal and dietary supplement, and also the over-counter medication or OTC. The diagnosis on DILI can be difficult because there is no current guideline on how to diagnose it, and the symptoms can mimic any liver disease. The first thing we do about managing DILI is discontinue the suspected drug. The difference between idiosyncratic DILI and intrinsic DILI can be seen on the table. First one is intrinsic DILI is common to be found while idiosyncratic DILI is rare. Intrinsic DILI is dose-related while idiosyncratic DILI is non-dose-related. Intrinsic DILI can be predictable while idiosyncratic DILI can't. And also, the time onset of intrinsic DILI is rapid or days, meanwhile the idiosyncratic DILI ranging from days to months. Intrinsic DILI can happen because patient was given high doses of drug, and idiosyncratic DILI can happen because patient having metabolic or immunologic reaction. Most common agent that can cause this type of DILI can be seen on the table.
My name is Putu Dharma Yuda with last 3-digit number 083. Based on the clinical presentation of liver damage as a result of DILI, can be classified into hepatocellular, cholestatic, or mixed. Hepatocyte injury is characterized by hepatocellular necrosis and is associated with a poor prognosis. Cholestatic The clinical manifestation of cholestasis, DILI, range from asymptomatic elevation of ALP to symptoms of jaundice, pruritus, and fever. Clinical features of drug-induced cholestasis are bland cholestasis hepatitis, secondary sclerosing cholangitis, and vanishing bile duct syndrome.
My name is Dewa Naraswari Mesi with 3 last digit of name 074. Oral absorption of the drug does not work properly in the patients with cirrhosis of the liver due to gastritis and ulcers on their upper gastrointestinal. Patients with cirrhosis experience delayed gastric emptying, resulting in decreased effects of hormones such as secretin, glucagon, cholecystokinin, or motilin. Patients with cirrhosis have oedeme, which causes an increase in the volume of distribution. Consequently, the loading dose of hydrophilic drugs is increased when fast-acting drugs are required, such as antibiotics and the digoxin. An increase in the volume of distribution is associated with an increase in the drug recovery time. Sinusoidal exchange of blood and hepatocytes is reduced due to the presence of fibrosis that impairs blood flow. Damaged tissues in the liver increases the flow of sinusoid, causing portal hypertension and predisposes to the creation of a portosystemic shunt, which bypasses the damaged sinusoids and delivers blood from the portal vein into the systemic circulation. This causes the drug taken orally does not undergo metabolism. High and poor clearance of extracted drug metabolites is responsible for impaired drug elimination. Reduced plasma protein binding is an additional mechanism by which cirrhosis may modify hepatic elimination of drugs.
My name is Yuda Sutedja with last 3-digit name 080. I'm going to explain about pharmacodynamics in patients with impaired liver function, in which drugs are metabolized differently by the body. In general, there are 3 outcomes in which an impaired hepatic function can affect pharmacodynamics. The first one is an exaggerated response to the drug, a reduced response to the drug, or an increased toxicity. These changes are influenced by the function of the brain and the kidneys. Some examples of the drugs that have an increased response in patients with impaired liver function are drugs that affect the central nervous system, or the CNS. These include opioid analgesics, anxiolytics, and sedatives, which can increase the sensitivity of the GABA system. On the other side, drugs like beta blockers and diuretics have a decreased response in patients with similar hepatic function. It is suspected that it is related to the reduced density of beta-adenosine receptors and change in number function of nephrons in the kidneys. As with increased nephrotoxicity, it can happen after one single dose, as in the case of paracetamol overdose, or accumulated throughout the drug regimen, as in the case of methotrexate.
Hello, my name is Diva with your last digit of name 084. Right now, I'm going to explain about therapy of impaired liver function, especially about lifestyle modification. Lifestyle modification is one of the steps of treatment for impaired liver function. Lifestyle modification combines specific recommendation on diet and physical activities. First, about diet. Diet therapy for impaired liver function, better known as liver diet, not only mean the replenishment of calories and nutrients, but significantly affect the course of the disease. A span in 1997 recommended the dietary goals, including first, most energy originates from carbohydrate, about 60 until 65%, which is rich in cereals, fruits, vegetables, and honey. Protein should provide about 12 until 15% of the total daily energy contained in meat, lean cottage cheese, skim milk, eggs, and fish. Reduce the amount of fat consumption as much as possible, about 40 until 60 grams, and use vegetable fats, for example, olive oil. Vegetables and fruit can be eaten raw or cooked, and then it is recommended to salt the food in moderation or unsalted diet. It is recommended to not prepare dishes with grilled dishes, frying or pouring dishes over the heated, cooked, or fried fat. And then meals should be taken more often with smaller meals. And smoking is not recommended. And the last one is about alcohol is strictly forbidden.
First of all, let me introduce myself. My name is Arya with your last digit name 089. Now I will explain about the second lifestyle modification for therapy of impaired liver function that is based on physical activity. So basically, physical activity is any action that needs the body to expend more energy than it does at rest. The term NAFLD or non-alcoholic fatty liver disease is the most common chronic liver disease and defined to describe excess accumulation of the hepatocellular triacylglycerol. In patients with NAFLD, high level of physical activity lowers intrahepatic triglyceride levels and indicators of hepatocellular damage, regardless of weight reduction. As for the recommended physical activity intensity is 150 to 200 minutes of moderate intensity aerobic physical activity per week in 3 to 5 sessions and 30 minutes of physical activity at least twice a week. Physical activity also prevents the proposed two-step formation of steatohepatitis, which comes as a result of abnormal fatty acid and lipid metabolism, contributing to higher hepatic lipid deposition and impaired export, as well as the novel lipogenesis accompanied by an increase in inflammatory cytokines and infiltrate within the liver. That's all from me. Thank you. And next slide will be presented by my colleague.
Hello, my name is Gregor Sulamtongratama with last digit name 085. Now, I'm going to explain about the medication in part of therapy of impaired liver function. So, commonly, mild liver damage usually resolved within a few days or weeks of stopping treatment. But in some cases, the injury is prolonged and persistent. Most of liver disease requires screening and evaluation, and sometimes also initiated intervention of another drug, like orlistat, or even patients with refractory hepatotoxicity need additional immunosuppression to service the therapy, such as mycophenolate mofetil, cyclosporin, tacrolimus, and anti-thymosid globulin. Early treatment for liver disease includes corticosteroid administration at a dose of 1 to 2 mg per kilogram per day, and if after 2 until 3 days of corticosteroid treatments, the disease is unrelieved, mycophenolate mofetil should be added. And that's all from me. The next slide will be continued by my colleague.
Hello, my name is Dharma, with my last 3 digit of name is 087. I will explain about general management therapy of impaired liver function based by the presence of one of the complication. First is hepatic encephalopathy. Hepatic encephalopathy usually treated by rifaximin and lactulose medications, where lactulose is used to convert ammonia to ammonium ions, which reduce its absorption from gastrointestinal tract. It also relieve constipations, which help alleviate hepatic encephalopathy symptoms. And rifaximin is used to help the gut flora reduce ammonia production. Second is esophageal viruses. Patients with this condition usually treat with aggressive blood resuscitation, vasopressor, and endoscopy. Propranolol is used for primary and secondary prophylaxis, while diuretics such as furosemide and spironolactone and sodium restriction are essential treatment options for ascites. And the last is hepatorenal syndrome, where patients with these conditions are treated by norepinephrine with albumin infusion and or octreotide with albumin infusion. And liver transplantation is the only definite treatment for patients who failed other medications. Thank you.
My name is Gede Diva Dhananjaya with the last 3 digits of name is 075. So now I will cover the conclusion aspect of our presentation. The conclusion is impaired liver function alters the drug pharmacokinetics and pharmacodynamics. The most common cases is drug-induced liver injury that can be classified into dose-dependent or intrinsic DILI and dose-independent or idiosyncratic DILI. Commonly, in impaired liver function condition, drug absorption rate is decreased, volume of distribution is increased, drug metabolism and elimination is impaired due to damaged hepatic sinusoid, and the sensitivity of some drug receptor or action site may be altered. The therapeutic objective in impaired liver function cases can be fulfilled by terminating liver damage-inducing drug administration, corticosteroid medication, additional immunosuppression administration, rifaximin and lactulose medication. If the medication is failed, liver transplantation can be done as the definite treatment. Meanwhile, as a non-pharmacological therapy, advising patients to modify their lifestyle, including diet, physical activities, is a perfect choice. Then, the advice of our presentation is, the writer suggests that before selecting any drug group for the patient treatment, physicians have to know the patient liver function condition in order to establish a rational prescribing that minimizes the risk of liver injury. The writers hope this paper could give useful information to the readers. We realize this paper is still far from perfect. Therefore, we hope for constructive advice and criticism to improve our paper.
That is all of our presentation. Thank you for your attention.